actually go to my colleague. So we have Elizabeth Oseguera first from the California Health Plus Advocates, and so she'll be sharing a little bit about their work.
Hi, my name is Elizabeth Oseguera, and I'm with the California Health Plus Advocates. Let's see if I can get this. Okay, so California Health Plus Advocates, we are the advocacy arm of the California Primary Care Association, and that pretty much means that we are advocating for the rights of nonprofit clinics and community health centers, and including their patients, which are usually underserved low-income folks. So quickly to pass our agenda, we're going to go through our past of community health centers and how we came to be, our future, making an impact, and events and resources that we have coming up. So our past. So community health centers that were created in the 60s during the civil rights and social justice movement. President Johnson's war on poverty kind of created the existence of community health centers. And this happened through the Economic Opportunity Act of 1964. Communities and local organizations took action to make sure that low-income folks had access to health care. And in 1965, it was the first few clinics to open up. And between 1970 and 1974, there was about 100 clinics that started opening up. So that's kind of, we arrived and existed through the social justice movement that created us. So California Primary Care Association was founded in 1994. It's a statewide trade association that, again, we represent community health centers and community clinics. So CPCA is a 501c3 charity organization, which pretty much means we're a 501c3 nonprofit. And we focus on advocacy, technical assistance, training, and program support. So the folks that we serve are, again, people from underrepresented communities, low income, usually make up our patients. So we have community clinics and free clinics, and then we have federally qualified health centers. And they actually receive funding through a 330 grant. And so they are federally funded to provide the services that we provide. We have FQHC's lookalikes, which means they're preparing to get like an FQHC, but unfortunately there's just no funding available. So once funding becomes available, they could apply to become FQHC. We also have migrant health centers, healthcare for the homeless, rural health clinics, and Indian health service clinics. And these are kind of different funding streams that clinics could have, and it could be different funding streams. You could be an FQAC and a migrant health center. So a bit about our health center patients. We see 1 out of 7 Californians. We have about 6 million patients, and most of them range between the ages of 20 and 64. Like I mentioned, we do serve low-income folks, so 60% are at or below the federal poverty level. We have around 53% Hispanic, and 38% of our patients are non-English speaking patients. And we have a large amount of migrant farm worker encounters and patients as well. And we do outreach a lot in the Central Valley to try to gather the migrant workers to come and see us at our clinics. For facilities and services, you could see on the map all the little red dots. Those are the clinics that are throughout California. There's around 1,150 clinics that we that are our members and that we represent. And there's kind of a breakdown of how many of them are actually FQHCs, lookalikes, or free clinics. And 67% of our patients are in Medi-Cal. This is a bit on our revenue streams. As you can see, we have a large percent of uninsured, which is 30%, and then we have, again, a large percent of using Medi-Cal. So affiliates and brands. So these are folks that we work with / we help fund. So CPCA is there, California Health Plus Advocates, which is the advocacy arm is there, along with Western Clinicians Network, Calypsa, the RAC Association, and some others. And the RAC Association is kind of, there's the clinic, there's the consortium, and there's the RAC. So it's kind of like the breakdown of how clinics and the associations that represent them are. A legacy of legislative success. So these are some of our advocacy in which it actually came to be something good out of it. So ACA, we helped advocate for that, Health for All Kids. Alternative Payment Methodology Pilot Program, which is the APM pilot program, which would allow health centers to provide whole person care outside of the current PPS rate, which, if to get just a little bit technical, PPS pretty much is the way that we get paid. And so under PPS, we're only allowed to do billable providers, which means there are a list of providers we could only bill for. Other than those, we cannot access them, we cannot hire them. So through the APM pilot program, we would be able to hire as many providers as we would like and spend the money as we would like to provide the care that our patients need. So for our future, like I said, the Affordable Care Act, it was one of the big pushes that we did, and it's one of the big changes since Medicare and Medicaid, in which providing or trying to provide universal health care. Changing landscape, as you know, we now have a new president that is in attempts of repealing the ACA. His last attempt failed, but there's continuous conversation about repeal and replace happening. Federal priorities. So this is kind of what we're looking to advocate for in the federal level. Obviously, Medi-Cal, ACA are on the list. We also have workforce. We want to make sure that we fully fund the National Health Service Corps and the teaching health centers, because this is how we build up our workforce here in California. We also are fighting a lot around immigration. Recent executive orders have increased fear of deportation in our patients, and unfortunately, we see a lot of them asking to be disenrolled from programs like Medi-Cal, or asked not to be seen at our clinics anymore because, again, fear of deportation. So we're working around trying to put in policies and procedures and signage and things like that to make our patients feel more comfortable. State priorities. So this is kind of what we are looking to do in the state level. So we have two bills we're sponsoring, SB 323 by Senator Holly Mitchell and SB 456 by Senator Richard Pan. The first one, 323, would allow FQHCs and rural health clinics to expand their behavioral health services by allowing us to enroll in drug medical and offer specialty mental health services outside of PPS. So again, PPS is how we are paid. We're trying to allow ourselves to do contracts outside of that for drug medical and specialty mental health. And this will allow a more whole person approach of care for our patients. SB 456 will kind of improve the health of California's most vulnerable people by allowing health plans, counties, and other partners with FQHCs to provide continuity of care services not covered by current reimbursement systems. So this would pretty much go back to our APM pilot program and allow us to do whole person care. Oh, my bad. So 340B prescription drug program, that's a big budget push right now. Clinics right now are allowed to get less expensive drugs, and that's through the 340B program, and unfortunately that's under threat right now. So we are working with DHCS and some other governmental entities to try to address the concerns. We also have the primary care workforce budget push. So last year we got $100 million to help fund our primary care residency programs, but unfortunately that got pulled from the budget this year. So we're trying to get it back in. We're also doing a push around newly qualified immigrants. and allowing MFTs to become a billable provider under PPS. Both of these, well, for the MFT bill, AB 1863, it got defunded, similar to the $100 million. And newly qualified immigrants, the governor's budget proposes to move them all into covered California, and our ask is to keep them under Medi-Cal. So making an impact. And here's a funny little picture about Jaws. You need a bigger boat because, well, there's a lot to do. We need more people. So advocacy is the active process of supporting a cause or proposal or advocating for something. And to me, that pretty much means advocating for the rights, for your own rights and the rights of others, making sure you stand up and you let your voice be heard. So how to get involved or how to do advocacy is getting involved, making your voice heard, understanding the cause and everything that's going on around it. So for example, if you're advocating for immigrant rights, knowing what current immigrant rights exist, what are the current legislations that are trying to change those rights, kind of know the sphere that you're going into and advocating for. Share your personal story. That's one of the best ways to do advocacy, is to let people know how the current situation or political changes are impacting you or your family or loved ones. Follow directions, and that just simply means when doing advocacy is making sure you kind of have a script ready, you know what to say to the members, you don't go off that course because you may say something that could hurt the cause versus help the cause. And why to get involved is, again, it's for the things you believe in. It's to help people. It's to tell the real story, because sometimes we know media and other things skew the stories that exist. And then you're credible, you're authentic, you're real, you're somebody in our community whose these laws may be impacting. So making sure you, again, are making your voice heard. So how to make your voice heard, or more so when? Day at the Capitol. So May 3rd is CPCA's Day at the Capitol event. Event is free to attend, but we are asking that people register. And for more information, there's a link where you can click and see more info on the dates and the policy priorities that we're going to be pushing that day. But it'll all be around health centers and our patients. And like I mentioned, California Health Plus Advocates has been getting a lot more involved in immigration. So we have created an immigration resource page, and here, there's just a few of the things that we have on there. So we have Know Your Rights information in various languages. Spanish is also included. It's not on my list, but it's also there. We have talking points. So in case you are looking to walk around the Capitol and talk to members, we have talking points that you could use. We have resources for DACA and those employing DACA. We have information on the signed executive orders, along with other information and guidances around legislation that's being pushed right now. So the website's down below if you're interested in going. And if you have any questions, these are ways you could reach us. Advocacy at healthplusadvocates.org, healthplusadvocates.org, or our Twitter or Facebook. So use social media, and we'll see you there. Thanks.
Thank you very much. That was an awesome presentation. And now we have our next presenter on right now.
Hello, everyone. My name is Imelda Plasencia, and I'm the Consulting Health Policy Outreach Manager for the Latino Coalition for a Healthy California, a colleague of Adriana's, who's a leader on our team as a part of the partnership with Mi Mentor. And we're really excited about this partnership because we're really invested in being able to develop leaders within the health advocacy world. And so the presentation is titled Health Injustice and Radical Health. So health injustice, I think, just to start right off, it's important to recognize that there is injustice taking place within the healthcare system. And sometimes as health advocates, we may be we may be blinded to some of what's going on because of, being so invested and focused in being able to treat a patient. But there's a lot of factors that contribute to why your patient is there to begin with and understand, which speaks to the radical health piece. So radical health, for a lot of people, we believe that healthcare is a human right. And for a lot of people, that is a very radical statement to state that healthcare is a human right and everyone is entitled to it. It is very much a business. I think that's important to understand that our health system is a business. And so within a business, it's, influenced by money, services, what's available, and a lot of politics that come into play, who has access to healthcare and who does not. So a little bit about the organization. The Latino Coalition for a Healthy California is the only statewide organization with a specific emphasis on Latino health. We were founded in 1992. So we are a partner coalition type of organization. The partnerships that we develop with our organizations across the state are very important to us, and that's really where we build our strength. We recognize that together we are much stronger. There are three major functions of our work: public policy, advocacy, community education, and health and equity research. So those pieces are very important and are very much intertwined. The research that we develop with community members informs the policy that we advocate for and how we educate the community. Our key strategic areas are in chronic disease prevention, safe communities, healthcare access, and just immigration reform. Now, immigration reform is not inherently something that's a part of health, but we really are working on making that point visible, that immigrant rights are health rights and vice versa. Health rights are immigrant rights. And for more information and to follow our work, you can follow us on Twitter, Instagram, and Facebook. So recognizing the health injustice that is taking place, first, health access is urgent. People's lives are on the line. Under the Affordable Care Act, undocumented people aren't eligible at the federal level for health care access. So for a lot of people that are living with diseases, very chronic diseases, this is a matter of life and death. And so as you know how important your work is and that driving your passion to be engaged in this work. And so it is really important to go much deeper and beyond difference. It is so much more than cultural competency. It is important to understand the root of the injustices within health, and we'll get a little bit into that throughout the PowerPoint. So there's professional and personal experiences that are impacted by systems and are racialized. So we also understand that the personal is political and the political is personal, in that the healthcare system is subject to that as well. So the way in which we treat each other within the healthcare system is impacted by our understanding of race. For example, we've heard many instances where undocumented people of color, feel that because of their race or their immigration status, they are treated unfairly. We have a lot of cases of Medi-Cal patients that feel that they are treated inferior because they are under Medi-Cal and low income. And history is not dead, legacies are alive and well. So it's really damaging to be able to really neglect the history that we have within health injustice. A lot of amnesia that does take place with how we've mistreated people of color within the healthcare system that is important to bring to light. And as through our work, we're developing a growing relationship in addressing injustice. So as we do that, let's recognize our history and talk through how we're able to address this injustice. So me, myself, and I. This is really very personal, and this is really about you. Being able to engage in activism is a very personal choice, and so I'm happy that you have decided that it is something that you want to engage in and actually use your profession and your work to be able to create change. So there's different areas into being able to develop your consciousness and understanding of social justice and advocacy. First piece is I know. I know the history of racism and white supremacy in the immigration and healthcare system and recognize how it impacts current practices today. So being able to come to an understanding of education of how this legacy of injustice has taken place is really the first component that you want to focus on as far as your critical development. Next is I believe, being able to understand it within your body and within yourself, that this is truth and you want to be part of impacting the change. So I believe that racism and injustice lives on, and I play a role in addressing and changing this reality. So being able to recognize yourself as an active agent of change that moves you into I do. I challenge racism and injustice in the healthcare system, and I commit to ... So what you commit to is really what's the personal piece of it, based on your capacity, your availability, and your interest. Maybe you're interested in some of the racial dynamics within health. Maybe you're interested in immigrant rights within health. There's various areas of health that you can get involved in activism. Liz also mentioned workforce. You know, what does the workforce look like in terms of diversity, making sure that people that look like them are engaged in this work. So all of that moving from I know to I believe to I do. So the first piece of I know. So do you know Hippocrates? You may have heard of Hippocrates, and I believe that you take the Hippocratic Oath when you've completed your coursework and are graduating. So there's some very powerful statements that Hippocrates has made. Let food be thy medicine and medicine be thy food. I know that that's a very powerful statement as far as preventive care and just how to be able to take care of your body. Make a habit of two things: to help or to at least do no harm. So in that, recognizing that you're here to help and you're here to support, and to do no harm, you also want to cause no harm. That's a Buddhist belief. Wherever the art of medicine is loved, there is also a love of humanity. So inherently, he's saying that if you practice medicine, then you love humanity and you love human beings. So these are some common phrases from Hippocrates. However, what a lot of people aren't aware of is that Hippocrates there's a lot of hypocrisy within his work as well. A lot of Hippocratic writings speak to some races being superior to others based on biological findings. And they're interpreted as superiority of white races. So a lot of these policies were used to be able to justify slavery, social inequality, eugenics, immigration control, and the unequal practice of medicine. So for example, if an entire group of people is taught to believe that other people are inferior, then that justifies policies such as slavery, being able to treat people as objects as opposed to actual human beings. A lot of that is actually due to his research in medicine that justified that. Eugenics, if you're not familiar with the definition of eugenics is improving the genetic quality of the human population, higher sexual activity for people with desired traits, and reduced rates of sexual reproduction or sterilization for people with undesired traits. So for example, stating that Latina women and Black women have undesired traits. There's a history of sterilizing women of color so that they don't reproduce children. There was a recent documentary about the LA County Hospital in LA County, where I'm from, that speaks to some of the history of that LA County Hospital without women knowing, sterilizing Latina women. Some of the injustice in that, a lot of injustice in that, of course, and also medicine has also been used to for immigration control. So there's policies that we have where an entire group of people, the Chinese Exclusion Act, are denied into our country. If you have certain illnesses or diseases, HIV, for example, you've been denied entry into the United States. So a lot of unequal practice of medicine that we have in our history, and some of it is rooted in the people that within your own education, you're taught to really glorify, Hippocrates being one example of that. So in moving forward with that, it is so important to name the unnamed. Essentially, this is white supremacy. White supremacy can be understood as a logic of social organization that invents, reproduces, and revises multiple modalities of human domination and physiological violence. So this human domination is is reflected into the institutions and the systems that we have as a country. So the healthcare system, that's an institution. Immigration, that's an institution. Education, that's an institution. And if you're familiar with social justice, you understand how within those institutions, people of color are mistreated, and there's a higher I guess, a higher value to white supremacy and non-people of color. So this really goes beyond bad people in ideology, beyond thinking that certain people are bad, because it translates into our policies and our institutions. So thinking of it as an organizing model. And in that way, it's much more impactful and much more harmful because because it makes it difficult to access health care, so that being a matter of life and death, then being able to process it, it's essentially a legal way to be able to kill people and take people's lives. So understanding it as an institutional sense is very important. So immigration, healthcare, and racism and discrimination in the US to expand, there's been experimentation and mistreatment of slaves. So for example, they wouldn't use anesthesia because they felt that it was an additional burden. They're fine, they're slaves, there's no need for anesthesia. During the post-slavery and modern era, there was a lack of healthcare for new citizens and poor whites. So you heard from Liz about the development of community clinics within the United States. So there's social justice very much rooted in that, because there weren't institutions that allowed for low-income people of color to be able to access healthcare. And that's essentially the development of our community clinics, right? And there's been a lot of experimentation on communities of color. Excuse me. So I don't know if folks have heard about the Tuskegee syphilis study of 1930, where they were actually giving syphilis to Black men in order to, I guess, monitor the symptoms of syphilis and the impact that it was having on the human body. And this was done for the sake of scientific research, right? So a lot of people would justify that in their mind, stating, well, we're doing it for science, so it's okay. But who are you doing it on? It's predominantly low-income people, communities of color, and poor whites. So there's a very inherent injustice in that. It's not okay. And as stated before, how it impacts immigration policy. Some people are completely denied entry if they have certain illnesses when entering the United States. So moving into, I believe, right, being able to understand it within your body, your spirit, that you believe that this is truth and you move forward in that reality. So our history and our reality, it's so crucial to not deny. I think first acknowledging all of these realities is key, because we are a country that lives under various forms of amnesia. So existing reality is tied to our histories. The documentary was actually from I believe, 2014, very recent, about some of the sterilization taking place for Latina women. So a lot of those practices are currently still taking place. There's a crucial link between personal experiences and our movement building. So it actually reproduces unsafe dynamics and relationships if we don't recognize the link that the personal is having with the political. This is historical and ongoing forms of violence for communities of color. And because they are continuous, because they are ongoing, that is why it is so crucial that you become involved and engage and challenge some of what is taking place. Okay. So why does health matter? So institutional racism, what that can translate to is into housing segregation, employment discrimination, unequal wages, and other discriminatory practices. So as far as unequal wages, I believe Latina women get paid 47 cents to every man's dollar. Housing segregation, if you're familiar with the social determinants of health, you know that your lifespan and your longevity is really determined based on where you live, you know, whether you have lots of trees and clean air, or whether you're close to a lot of pollution, your water has lead in it, you live by a freeway. All of this impacts your health outcomes and your life expectancy. Employment discrimination, whether you're able to sustain your life and find work to be able to live. Right, all of these are institutions that are impacted by race, and at the same time impact health outcomes. So it's important to recognize all of the connections that are taking place as to why someone may feel sick. A lot of these sicknesses and illnesses that are developing, Adriana was just sharing earlier in preparation for this webinar, how a lot of people are developing stress and anxiety that is living within their bodies because of the high level of uncertainty for undocumented people and immigrant families that we are living in our current day. So all of these external social policies that are taking place being able to impact the body. So we have a lot of patients that are coming in and have symptoms of illnesses, but there's really nothing wrong with them. It's really this high level of anxiety and stress among immigrant populations that is causing them to be sick, have stomach pains, and various things that are important to understand the connections, and to, you know, when you finally see someone and why they're in front of you, and everything that is happening, having that context. So it creates persistent inequalities that lead to poor health outcomes and limits opportunities for communities of color. If someone is sick, there's a lot of, if you're interested in immigrant rights, there's a lot of psychological and physical battles that we are fighting, and a lot of them have to do with social policy within institutions, and all of that being connected to their poor health outcomes. So all of that being connected, intersectional, all of that is important in order to have a comprehensive understanding of the injustices that take place and how you can be a part of changing that. So how is white supremacy relevant to health justice? Social services are important, but if that's all the work, I'm sorry about that. So social services are important, but if that's all we work for, we are simply enabling people to survive in an unjust system. And that's from The Revolution Starts at Home. I really recommend that you read that book if you're overall interested in social justice. So what this quote is referring to is charity work versus revolutionary work. If you think of charity work is, you know, where you donate. For example, if you give someone without a home $1 or a sandwich, that's actually sustaining the injustice that it's taking place. It isn't impacting them being able to come out of the injustice or changing institutions. So a lot of being able to address the injustice, not that you shouldn't do those things, you should definitely do those things as we continue to work on long-term systems change. But the real change is taking place within our institutions. So we must change these systems and continuously challenge structures of violence in order to be able to have true revolutionary work. And the structures that we mentioned, these institutions in terms of housing, healthcare, education, immigration, all of those are the systems that need to take place in order for people's lives to really change. There's definitely ways to be able to support people in short term, which is charity work, being able to offer people, you know, being able to volunteer as a physician for a free clinic. All of those charity work is very much needed, as long as you understand that that's only the beginning to this much larger system change that needs to take place for health justice to really manifest. Okay. So another quote from The Revolution Starts at Home. How is all of this relevant to health justice? Healing from personal experiences is not just a matter of personal health. Healing is a matter of social change. Our communities have suffered lifetimes of abuse, genocide, slavery, colonialism, massive incarceration, deportation, and police violence, being only a few of the obvious examples. So when you think of health, I really challenge you to think beyond clinical health, think beyond the medical. health is something that is much more profound and deep, that speaks to the essence of a human being. Their happiness that involves health and love, laughter, joy, all of that that is incorporated as a part of health is crucial to social justice work and the way that we work with each other in order to be able to create this change. Okay, so moving to I do. You are an active agent of change. What can you do? So just to reflect a little bit. So the work that we do to undo the quantities of internal and external injustice is not just what we do in our job, but how we treat ourselves and one another in the process. Understanding that engaging in social justice is very personal. It is something that you embody. It is a matter of who you are. Engaging in social justice, it's something that that you believe, you recognize truth, and want to be a part of change. If you're interested in more readings, I recommend reading Paulo Freire, being able to talk about really the embodiment of this change. Okay. So moving as a champion to change, I want you to move into being able to state, I am a role model for addressing the history of racism, health disparities, and injustice that live on in the health justice movement, and I play a role in addressing and challenging this reality. I have suggestions on how to be able to challenge this. Excuse me. And as we move forward in the webinar series, you'll be presented with various other ideas of how you can engage as well. But just foundational ways to be able to engage. Acknowledge and question the reasons for disparities between races and quality of life. So first, there has to become an understanding of why. Ask why and challenge your normality. Why are things this way? Why is it that this neighborhood has so many liquor stores and lack trees, and I don't see many parks here? Why is it that this community has a bike lane? I've never seen that before. So being able to question and challenge those is a good first step. Name and engage in conversations about white supremacy and racism in the healthcare system. So being able to even say the word white supremacy, I know can be challenging for some folks, or some folks may even cringe when they hear the word white supremacy. There's alternative words that you can use depending on your audience, but it is important to name them as such. Engage even when it is hard. So recognize that it is actually a luxury and a privilege to be able to walk away from these difficult conversations. Low-income communities of color, poor whites, don't have the luxury to walk away from these conversations because they are living it. This is their reality, and they have no choice but to be able to address them. So recognize that even though these conversations may be hard, they are needed and necessary to create a healthy environment. Create safe spaces to have these discussions. So unless we have the skills, it may be a bit intimidating to be able to address some of these issues. So creating a space where it's okay to make mistakes, it's okay to ask questions is really crucial. Also, expand your feelings and thoughts about white supremacy. This may be new information to you, or this may be information that somehow you already knew but weren't able to maybe put a name to it. So being able to learn and expand on that is really important, especially living within the United States. There are various forms of racism that we are seeing within our policies, within immigration system, within the Muslim ban, the refugees, this bombing of Syria. There's various forms of white supremacy that are being played out in our personal relationships, but also within our policies and in international policies. Choosing to come into organizing spaces, really be critical of organizing structures and movements. So yes, there are people that are wanting to create change, but we all are in a development process of doing that. So being able to challenge people as we organize them is really important too. Okay, so thank you everyone. It was a pleasure. Again, my name is Imelda Placencia, the Consulting Health Policy Outreach Manager with the Latino Coalition for a Healthy California. And I believe we'll be moving on to your questions.
Thank you very much. And Adriana has a couple announcements to make.
Hi, everyone. Yeah, before we move to our speakers, I just wanted to let you know that this was the first webinar in the webinar series. So just wanted to share with you the next webinar we have is coming up Wednesday, April 26th, also from 6 to 7 p.m. And we'll be having the California Physician Alliance and their branch, the California Health Professional Student Alliance, present on injustice in the healthcare system and the power in identifying as an advocate. So they'll be having a medical student talk about their experience on engaging in lobby days and different aspects of advocacy. And then we will also have, a date isn't set yet, but it will be the second week in May with the pre-health dreamers, who will be talking about sharing their story, especially if you are of undocumented background or know friends, family who are undocumented and they're seeking higher education, how to be able to write that into your applications. And there will be some other webinars coming up that have yet to be scheduled, but be on the lookout for those. So yeah, time for, if you guys have any questions for Liz or for Imelda, they can answer them.
And we had a question saying, how do we register for additional webinars? And to register for additional webinars, you go on the Mi Mentor website and you'll be able to look up all information there for upcoming webinars. And we do have one question in right now that's asking, how can we make others aware of the injustices that face them without pushing them away? Maybe, okay, yeah. So again, how can we make others aware of injustices that face them without pushing them away?
Okay. I can take that question. This is Imelda, and I think it's first, really being able to validate that. When it comes to social justice and injustice, there's a lot of tension, right? And I think there's tension about people being right, people being wrong, and when approaching that, I think it really depends how. First who, right? Is it a friend? Is it a professional? Is it a colleague? But overall, I think it's important to be able to educate with compassion. There's certain levels of approaches. I think if you find someone that's a little bit argumentative and it just isn't being open to listening, sometimes it's better to not engage if you feel like this person just isn't going to change their mind. So just in terms of your own capacity to be able to engage. If you do choose to engage, understand that it's about educating people. So I'd recommend, hey, did you know that Hippocrates, some of his writings were actually rooted in racism? Oh, I have a link that I learned. I'd be happy to share it with you. Or did you know that Chinese people were actually excluded from entering the United States? I believe that it's actually a bit racist to be able to do that to an entire group of people. So a bit of, oh, did you know, or I have this resource, or actually I heard that, so it's best to use I statements. I find personally, like, oh, well, actually I learned that, so in that way it doesn't feel like you're attacking someone, making you statements, or, don't point or be like, no, you're wrong, or no, that's not true, or no, it may it may take people away from wanting to listen to you. So initially, if someone is open-minded and open to listening, being able to share some facts and statements that you learned is helpful. And at the same time, I would recommend, if you feel like someone isn't open to engaging and they're being very critical or they're attacking, I wouldn't want you to put yourself in harm's way. Sometimes it actually is best to not engage if you feel like the conversation isn't going anywhere.
Are there any other questions that anyone has? We have a couple minutes for question and answers. Sydney, let me unmute you. Sydney, go ahead if you can ask a question. We can't hear you, Sydney.
Sydney, can you type in your question? If you're able to type in your question, Sydney, I think that would work out best to help us with our technical difficulties.
While we're waiting for Sydney's question, does anyone else have any questions? Oh, okay, so let me read Sydney's question. With changes in legislature happening so quickly, how do we best stay up to date?
Do you answer it? So the best way to stay up to date is to get connected with organizations that have alerts on actually what's taking place. If you haven't done so already, please visit the Latino Coalition for a Healthy California at lchc.org and get connected to our listserv. We do send out regular updates about what's taking place in healthcare.
And this is Liz. I would recommend for healthcare, you could go, if you're interested in immigration, go on to our immigration resource page. We update it almost weekly with new information and updates. And in case you're really, enthused and really want to follow legislation, there's also a website called LegInfo, in which you could follow bills, get notifications whenever that bill is amended or is being heard on the floor. So it just depends on the type of involvement you're looking to have.
To add, if you're looking for something that's more engaging, we are working on being able to connect you to some of the lobby visits that are taking place. So like Liz mentioned, CPCA's Lobby Day. We also have Immigrant Day that is coming up in the Capitol to be able to advocate on immigrant rights bills that are taking place. Some of them intersect with health access. One in particular, SB 54, which is the California Values Act. It allows essentially to create sanctuary spaces within California's institutions, and it does not allow for California resources to be used to support the deportation machine that is taking place.
And to add yet again, I would say tuning into NPR News or such things, going on Reddit, looking up on articles. And there's this new app that I'm in love with, so I'm going to share it with you guys. It's called Countable. And so pretty much it does like a bunch of news sources for you. It lets you know when members are voting on things, and you could actually vote and contact your member through the app.
Every social justice advocates app right there. Download Signal. Any other questions? No? Okay, so it seems that all of our questions have wrapped up. Thank you again, everyone.
Thank you everyone again for attending our webinar. We want to be respectful of everyone's time. Thank you very much again to our two speakers, and hopefully we'll see you again next week. Let's give them a round of applause or 6 types and 6s on the chat box so they can see your thumbs up. Thank you very much everyone for attending. Thank you, Sasan, for your thumbs up. Sasan enjoyed it. I think Sasan's the only one that enjoyed it because he has only one thumbs up. Clap, Sydney. Sydney has a clap. Okay. Well, have a good evening, everyone. Thank you again for joining us. And look on Mi Mentor again to stay updated with current events for all our future events that will be coming up for this series. Thank you very much again. Bye.